Good to talk to you today. Your question in the Commons following Wes Streeting's announcement, it seemed that you were cautiously optimistic about the plans. What do you see positive here? What do you perhaps see as negative?
Well, good afternoon, Jane. I think the risk here is that if bureaucratic over-centralisation that is grinding down the NHS is replaced with political over-centralisation, then these reforms will fail. And heaven forbid we end up with the structures they have in the NHS in Wales, where the waiting times are even longer than in England. But if this means we start to regulate with a much lighter touch, in the way we do with schools, for example, where heads have much more autonomy, they have Ofsted, they have their exam results published, but apart from that, it's largely left up to them. And we've seen standards rise in schools, we see much more innovation, we see failing schools turned around much more quickly. If that's what this means, it could be very transformational. So I think the proof of the pudding is in the eating, but like you say, I am cautiously optimistic that this is a positive step.
Is that your understanding of the way that these reforms will work? That was your question. Do you feel that Wes Streeting gave you the answer that you wanted to hear there?
He gave me the answer that I wanted. He said, absolutely, we want to decentralise the NHS. I suppose the warning bell in my mind is that this wasn't what happened under the last Labour government. I mean, you had a very centralised NHS with very, very severe top-down targets. And that led to a lot of terrible scandals, like at mid-staffs. So providing Wes Streeting is learning the lessons of what went wrong the last time, I think this does have the potential to be the right way forward, but I think we do need to keep our eyes very wide open as to the risks when you do something like this.
How challenging do you think it's going to be to implement the changes?
Well, I think it is going to be challenging, and I think, the real question is, will the government be brave and just get rid of all these central targets, not in a way that means that we don't know what's going on. I'm a strong believer in transparency, but really free up local NHS managers on the ground to run things more efficiently, improve the quality of care and do more prevention work that stops people needing to go into hospital in the first place. We have the most micromanaged healthcare system in the world. It's the largest healthcare system and it's the most overmanaged. If you're on the ground in Norfolk or Surrey or Devon, you will probably be working to about 100 monthly operational targets. And it's just not possible to really innovate and do transformational changes when you're kept on that kind of a short leash. So that's why I do think ultimately this is the right direction of travel.
And in terms of monitoring, the Care Quality Commission, which you helped bring in, the fact that you say that this should be maintained, and Wes Streeting too concurred with that, why is that important that is maintained?
Because if not, we're going to end up with another mid-staffs. I mean, the reason why the mid-staff scandal went on for 4 years before being sorted out was because nobody was independent there to sort of blow the whistle on the terrible failures of care that were happening. So you need a body like the CQC, like Ofsted in education, that calls a spade, that says, look, here, Houston, we've got a problem, and it needs to be sorted out immediately. And so I think alongside decentralising, you do need to make sure, and the CQC, as Wes Streeting said, has had some big problems. They're under new leadership, which we're all hoping will turn it around. But you've got to have someone who is there acting for the public, saying where there is poor care and making sure it gets sorted out.
These plans are going to mean a lot of job losses, one estimate as many as 6,000. Do you have any sympathy for those people within the NHS who may suddenly have a slightly different future than the one they were anticipating?
Well, it could be even more than that. It could be 9,000. But, the NHS has got 1.5 million people in it. And I'm absolutely certain that capable, smart people will find another role inside the NHS. But it needs to be at a more local level where they can really make change happen on the ground.
Do you think that these proposals go far enough for the digital transformation that I know you're really keen about, that you really want to see happening within the NHS?
Well, it's a really good question, and I think my answer to that, Jane, is that, you know, when you have a hospital chief executive that is being micromanaged by NHS England, it makes it really hard for that person to put in place a big new IT system, because they're constantly having to report back on how they're going to get, you know, A&E performance up 2% by the end of next month and so on. And in any other hospital, if that person was running a hospital in France or Germany, their first priority would be to sort out the IT system so that the place runs efficiently. So I hope this will unlock a lot more interest in the potential of digital transformation.